I guess the image is self-explanatory. So a long incision is given from mental foramen to mental foramen in the lip region, okay? And this flap has to be raised supra-periosteally. Okay, so यहाँ पे periosteum भी होता है, if you remember. साथ में raise करते हैं. And once you have raised, let me show you the animation. So you can see this is the bone, this is the periosteum, and this is the epithelium. Can you see this is continuous with the epithelium of the lip? So what we do is we raise a flap, okay, in the lip region. The incision is in the lip region and the base is at the alveolar ridge. Yeah, we raise the flap. The dissection is done supra-periosteally above the periosteum. This red line is the periosteum, and this flap is sutured into the desired depth of the vestibule. And then this area is allowed to heal by secondary intention. Okay. Now, आपने कोई भी wound देखा होगा that heals by secondary intention. There is always some contraction, right? There is scar contracture. So the disadvantage here is that there is scar contracture and post-op swelling is also there. Then there is a modification of Kazanjian's vestibuloplasty. Can you see this? This is the Kazanjian vestibuloplasty. And there is Godwin's modification in which the length of the flap is up to the vermilion border of the lip. Okay. So just the modification is Godwin's may we have the longer flap and Kazanjian may comparatively a shorter flap. That's it. Okay. The procedure is the same. We remove the submucosal, the connective tissue, and we just suture this to the desired depth. Okay. Then there is something called a lip switch vestibuloplasty. Switch ka matlab we are replacing two things into each other's position. Okay. So in this what we do, just like Kazanjian, we give an incision in the lip region. The flap is based, the base of the flap is over the alveolar ridge. Okay. The base of the flap is over the alveolar ridge. Now this dissection is supra-periosteal. Periosteum के ऊपर से ये separate करें. Periosteum अभी भी bone पे चिपका हुआ है. Okay. Once you have raised the flap, then what we do is we take the periosteum from the bone and then we cover the raw area in the lip region. Okay. So we raise the lip, the epithelium, the flap, and then we take the periosteum from the bone and we cover the raw area in the lip region with the periosteum. Okay. And this is the lip switch technique. Now let me show you the animation if it works. Okay. So we raise the flap. Okay. And then the periosteum is placed over the raw area, and again the flap is close to the desired depth of the vestibule. So this is the lip switch technique in which we extend the position of the flap and the periosteum. Periosteum की जगह पे हमने flap close कर दिया, and flap जहाँ से raise किया था वहाँ पे हमने periosteum place कर दिया, and then we suture it. Okay? समझ आया? Lip switch is simple. Okay? Then we have a something called as Clark vestibuloplasty. So अभी आपने देखा था in Kazanjian vestibuloplasty, the base of the flap was at the alveolar ridge and the incision was given in the lip region, right? इसमें उल्टा हो जाएगा. This is the opposite of the Kazanjian vestibuloplasty. In this, the incision is given over the alveolar ridge and the base of the flap is at the lip region. Okay? And then we raise the flap, deepen the vestibule, and then we suture the flap to the depth of the vestibule. Can you see? Simple. This is the Clark vestibuloplasty. Now, why do we want to do this? As I mentioned earlier, there was a raw area in Kazanjian vestibuloplasty. There will be contraction of the area, raw area. Whereas if we keep the raw area on the bone is not going to contract, right? So there is no contracture seen in this case as compared to Kazanjian vestibuloplasty. And suturing is done. And if you want the suturing to be stable, you can keep you can pass the suture through the submandibular region here. पूरा स्किन के बाहर निकालेंगे. Either you can use gauze rolls, gauze रख के उसके around suture लेके we tie it inside, or we can use buttons. Button में से pass करेंगे, so it will give a extra stability. Then another option is instead of leaving the alveolar bone raw area, we can use a soft tissue graft, split thickness graft to cover the raw area on the bone. Okay, so this is the Pegasus modification. Instead of soft tissue split thickness graft, we can use mucosal graft. We can use collagen membrane also. Okay. Now we come to something called as pocket inlay vestibuloplasty. Now, abhi sare procedures mein we saw that we are giving a long incision, right? And dissection was done. And it is a little technique sensitive, and it is the longer the surgical area, the larger the surgical area, there will be more post-op swelling and pain, more discomfort to the patient. So to counter that, we have something called as pocket inlay maxillary vestibuloplasty. As the name suggests, it is done only in maxilla. Okay, so let's see. So this is the maxilla. You can see this is the vestibule of the patient, a maxillary vestibule. Now let's zoom out. So what we do, instead of giving through and through incision, we just create some pockets and we deepen the pockets in the region where the bone can take up a lot of pressure, a lot of force. And what are these areas in the midface region that can take up a lot of force? Trauma mein pada hoga buttresses, pyriform region, zygomatic buttress. Okay. So what we do is we just create pockets in these region. Okay. We create pockets in this region and इसके अंदर जो denture है उसकी just छोटी सी extension से pocket के अंदर extend करेंगे हम. So we increase the area for better stability. So let's zoom in and you can see we have created small pockets in the maxillary vestibule. Okay. So what we do in this is we just create a denture, prefabricate a denture along with these flanges. These are called denture के अंदर जो extension होंगे, they are called as flanges. Okay. So we just place the denture there and keep it in position for a period of heal. जब तक ये heal नहीं हो जाता तब तक we are going to keep the denture along with the flanges. Okay. Once it has healed, we can again reline the denture flanges and the patient can continue wearing these dentures. Okay.